Healthcare saves lives, but as more people access life-saving care, a growing challenge puts lives, especially children's, at risk. Healthcare waste accounts for nearly 6 million tons annually, adding to the 1.47 billion tons of global solid waste. Healthcare waste comes from healthcare facilities, hospitals, clinics, laboratories, dental and veterinary offices, blood banks, mortuaries, and even home care settings. As healthcare services expand, the volume and complexity of healthcare waste continues to grow, making safe management increasingly critical. Around 15% of healthcare waste is hazardous, infectious, chemical, or even radioactive, and poses serious risks to children and communities.
It is not just the waste itself that harms children, but how it is managed. Improper disposal and processing release harmful pathogens, toxic chemicals, and airborne pollutants that put communities at risk. Improper handling, treatment, and disposal of healthcare waste threatens children's health in many ways. Sharps can transmit blood-borne pathogens. Pathological waste can spread viral, bacterial, and parasitic infections. Chemical waste can cause inflammation, organ damage, and neurotoxicity. Pharmaceutical and cytotoxic waste can accelerate antimicrobial resistance, cause immunosuppression, and disrupt hormonal balance. Radioactive waste can have genotoxic effects, and airborne toxicants from incinerations are neurotoxic to developing brain.
Healthcare waste should be properly sorted, treated, and never disposed of near homes. When healthcare waste is mismanaged, children face greater risks of infection, toxic exposure, and injury. These risks can lead to long-term impacts on their health, development, and overall well-being. Protecting children from healthcare waste starts with strong government leadership. Governments have the responsibility and the power to set national frameworks that keep children and communities safe. That means establishing clear, enforceable laws and policies, creating a national plan with defined goals, timelines, and responsibilities, allocating funding for infrastructure, introducing non-burn treatment technologies, and promoting clean and safe waste management treatment methods. This needs to be supplemented with improved data systems, strengthened workforce capacity, and monitoring facilities through regular inspections and enforcement. In the health sector, prevention is the first step. Hospitals and clinics, both public and private, can reduce waste at the source by choosing eco-friendly products, limiting single-use plastics, repurposing unused surgical items, training staff to avoid over-ordering supplies, investing in technologies like autoclaving, improving segregation, tracking and disposal, monitoring environmental risks, and utilizing engineered landfills.
UNICEF is partnering with Gavi and the Global Fund to support governments in building safer, more sustainable healthcare waste systems that protect children, communities, and the environment. In Malawi, strong government leadership is driving progress on healthcare waste. UNICEF has supported the Ministry of Health in developing a national waste management roadmap built on site assessments, system analysis, and long-term planning. The roadmap is government-led and focused on sustainable implementation. In Cambodia, UNICEF supported the introduction of non-burn technologies and trained healthcare workers in safe waste handling. This has reduced toxic emissions, protected frontline workers, and helped communities adopt more climate-friendly solutions. In Uzbekistan, government with UNICEF support have made significant progress to improve healthcare waste management across the system. We supported the development of national policies and technical guidelines, as well as the procurement and operationalization of essential equipment. Through establishment a local healthcare waste management training team, UNICEF Uzbekistan has helped build capacities at all levels, training healthcare workers, waste handlers, and facility managers. These efforts have improved consistency, reduced risk of exposure, and enabled safer, more sustainable waste treatment aligned with both health and environmental standards.
Together, these actions protect not only the environment, but also children's right to grow up in a clean, healthy, and sustainable environment. Now is the time to act.